We have a very large laboratory looking at new development, drug development for patients with glomerular disease. And one of the concepts I've developed in the past few years is this concept that in the setting of protein leakage in the urine, we have the cells that actually cause this leakage, the podocyte, get filled of lipids and fat content. It becomes like a fatty cells. To the point that I think we've described the concept that kidney disease, glomerular disease, are a form of fatty kidney disease that leads to this infiltration of fat in the kidney, just like we hear from fatty liver. No? And so in a consequence of this finding, we have actually worked to develop a small molecule that is an oral agent that actually can be safely administered to patients. We're completed phase 1 trial, and the idea is to actually bring it back to the patients and the community. We are soon to start the trials in FSGS and other collagen-related disorders with proteinuria, and actually that's probably the most exciting things we're doing right now. I'm really thankful that this exercise of having our patients, the foundations, allowing us to bring the bedside observation to the bench, and now back to the bedside, back to the community. It's a great exercise, and what I call what I really would like to say is that patients and patient foundations are really the dynamo turning this wheel of medical knowledge from the bedside observation to the bench and back. Well, what I want them to know is you're not alone. You're united by rarity to other patients, by rarity to other patients. And so reach out to the foundations, work with the foundations, don't be afraid, and there's a lot of hope. 20 years ago, we had very little medications in this space, and right now there's so many opportunities for newly diagnosed patients to actually enroll in clinical trials. So if there is one suggestion I would like to give, make sure you enroll in a clinical trial. We owe it to you and to your family and to the community and the children. Well, it's very exciting. No? We've been sitting from the 90s when the ACE inhibitor and angiotensin receptor blocker were the solution for kidney, and we're still been dialyzing and transplanting patients. And obviously all these new class of agents that are being studied, but as well as we have heard about the SGLT2 inhibitor, we have heard about the finerenone, all these new drugs that are coming into space that are actually offer protection from reaching end-stage kidney failure, but also protection from cardiovascular disease that is really the killer from patients with chronic kidney disease. It's really an exciting time. And it's exciting for me to be the funding scientist for 2-3 different companies that have actually out-licensed my invention for development in this space, because I want to be able to contribute to a cure. Well, they maybe find me jogging, and then if I get knee pain, they maybe find me swimming, and then if I get shoulder pain, they may find me playing tennis. So I alternate between different sports, and I really enjoy doing that. I love to spend time with my kids. I love cooking. I mean, COVID has brought me to enjoy cooking. It's the only things that really distract me completely from my email, and I love doing that.